Good day, we are going to deal with rest of the brushing techniques. Stillmans method. Like the Bass method, the filaments are placed at 45-degree angle to the tooth. Unlike the Bass method, the filaments are placed half in the sulcus and half on the gingiva. The same stroke is used as on Bass method. Next, Charters method. In this technique, the bristles are placed at an angle of 45 degrees to the gingiva with the bristles directed coronally. The bristles are activated by mild vibratory stroke with the bristle end lying interproximally. Advantages are the technique is specifically indicated in patients with orthodontic and prosthodontic appliances and effective plaque removal suitable for periodontal surgeries. Phones technique. In this technique, the brush is placed against a set of teeth and is moved in circular motion 4 to 5 times after each set of teeth. Advantages: it is easy to learn, takes short time, physical or emotionally handicapped individuals. Disadvantages: trauma to the gingiva, improper cleaning of interdental areas. Leonard technique. In this technique, the bristles are placed at 90 degree to the facial surface on the clenched anterior or posterior teeth. With the teeth edge to the with teeth edge to edge, place the brush with filaments against the teeth at right angle to long axis of the teeth. Brush vigorously without great pressure with up and down stroke on the tooth surface with a slight rotation after striking the gingival margin with force. Advantages: most convenient, effective for small children with deciduous teeth. Disadvantages: interdental areas are not cleaned properly. Horizontal scrub technique. In this technique, the bristles are placed at right angles to the long axis of the teeth and gentle horizontal scrubbing movement of the brush is performed. Advantages: free style of brushing, requires vigorous horizontal, vertical, and circular motions. Disadvantages: ineffective at plaque removal, tooth abrasion, and gingival recession. Modified Stillman's technique. In this technique, the bristles are pointed apically with an oblique angle to the long axis of the tooth and placed partly on the cervical aspects of the teeth and partly on adjacent gingiva. The bristles are activated by short back and forth motions and simultaneously moved in a coronal direction, following 20 strokes. Advantages: the technique provides good gingival massage and interproximal cleaning. Disadvantage: this technique is difficult to learn and implement. Hurstfield brushing technique. This technique is same as the Charters method, except in the maxilla and mandible are kept occluded. The Hurstfield technique is also a modification of Phone's technique, where the circular motion is much smaller and concentrated over the gingival surface. The advantages: provides additional stability and control to those who lack dexterity. Cheeks help in exerting pressure required to flex the bristles. Physiologic brushing technique. The brushing technique, the brushing method is the same as that taken by food during mastication. In this technique, the bristles are placed at the height of incisal edge or occlusal surface at an angle of 90 degrees and moved in the gingival direction. It produces frictional action similar to that obtained from mastication of fibrous food, suitable for patients having anatomically normal dentation. Advantages: it stimulates the gingiva and improves blood circulation in connective tissue. Disadvantages: in existing pockets, the brushing technique tends to strip the tissue away from the teeth and facilitates packing of debris into an open pocket. So I conclude by saying that depending on the individual cases, the techniques may have to be altered to achieve maximum beneficial effect. Reduction in plaque score was seen in modified bars and horizontal scrub techniques, and least seen in Fawn's technique. Thank you.